Assalamu alaikum, the communication day. The first scenario, Mr. Ahmed, 65 years old, presenting with acute dense stroke after stopping his warfarin 2 weeks ago by his GP due to hematuria. Your task to explain to Mrs. Hala, 28 years old, about her father's condition. Dr. Maeda, you ready? We can start?
We can start. Sorry.
Yeah, no problem. Here you go.
Okay. Hello, my name is Dr. Maida, one of the medical doctors. Just can you confirm that you are the next of kin of Mr. Sorry, the name of the patient again? Ahmed, you said. Ahmed, 65 years old. Are you his daughter?
Yes,
Are you the next of kin?
yes, I am.
Okay. We are here to discuss an issue about your father health. Do you know, can you tell me what do you want to know?
Yes, so my father is 65 years old. He is on more
Dr. Marwa, your voice is very so far.
now clear.
Yes, okay.
My father is on a medication called warfarin, doctor, because some condition in his heart. I don't know what exactly. But 2 weeks ago, he noticed a red color in his water work. When we went to the doctor, he advised him to stop the warfarin. Yesterday, he can't suddenly he can't move his arm and legs. We came here and they told us it is a stroke. I come to know why is stroke and why it is happening.
I'm so sorry. I'm so sorry to hear that about your father. Yeah, so just to give you some background, that your father was on this medication, the blood thinner medication called warfarin, to his valve problem. So what happened is that during the normally when we have a blood thinner medication, we weigh the benefits and the side effects of the medication while we are trying to manage if there is any bleeding. And at that time, the GB found that to stop the warfarin, maybe at that time it was the best of interest of your father to stop the warfarin at that time. However, an unfortunate, the clot has happened, and your father now have this stroke. I'm so sorry for that.
Doctor, you mean that the GB was not know that if he stops the warfarin, the stroke may come again? How it's come? He is a doctor. He should know that.
I'm so sorry for what's happened. But as I told you, maybe at that time, we are just weighing the things. And maybe at that time, he think that the best of interest of your father to stop the warfarin for a while until the bleeding stops. Because the same time, if there is any bleeding, it's also can affect his life. The issue is that because the heart problem your father had, it's affecting his, it called this bloods to be clotted. And this is what happened at the moment. And I'm so sorry for that, that your father passed through this hard time.
Doctor, the hard times still presently. What will you do for him?
Okay. At the moment, because he had this stroke, and I afraid it is not a small one. It's a large one. And that's why he had the symptoms of weakness in his legs and his arms, and we call it massive stroke. Unfortunate. This happened today. Yeah, we'll discuss this with our neurologist. And
Yesterday, doctor.
yesterday.
Yes.
Okay, so we'll discuss his management plan with a group of doctors, that's including the neurologist, the brain doctor, the stroke doctor, and we also discuss with the heart doctor as well. We need the specialist nurse to be involved in the management plan of your father, and also we need the occupational therapist and speech therapist to support him, and we may need the physiotherapist as well to be to support him during his ill time, and to make sure that he can pass through this time. However, it's massive stroke. I'm afraid this at the end it may left him with disability.
So after all what you said, he will still have disability. He will not return to normal life.
I'm afraid yes, because it's not a small one. It's a large one, and it affects multiple part of his body and affects his mobility. So I'm afraid he may not return back to his baseline. But we try to make sure with the physiotherapy and neurotherapy to help him to gain some ability, some of his
So it is not
abilities.
accepted. It's not accepted. You make permanent disability to him. Instead of treating him, you make permanent disability to him. I want to complain. It's not accepted at all.
Mhm. I highly appreciate that. I know you are frustrated, and everyone in your place can feel the same. And I hope we have a good news for you, but this is exactly what happened. And you are completely have the right to complain if you think so. And I can also show you way to complain, and in the patient license. What's the name? Now I forget it. Okay, so I can show you how to complain as well if you need help on that. But this is exactly what happened. It's not an area of mistakes or fault. It's an area of weighing the benefit versus the side effects, and the complications can happen. Is that okay?
Okay, I will complain, and also I want to take my father out of this hospital.
Sorry, I can't hear.
I want to take him to complete his treatment out of this hospital.
You want to take your father out of the hospital?
Yes.
Okay. At the moment, your father is not fully, uh, fully conscious, and I think he's not having a capacity, and
2 minutes left.
okay, and I'm afraid in this time, if he has no he losing the capacity, we work on his best of interest, and I think the best of interest to keep him in the hospital at the moment.
You mean it is not my right, doctor? It is not my right to take him out?
I highly appreciate that you are worried about your father, but at the moment, this is our role to keep to make sure that he's safe before discharging him out of the hospital, as your father lacking capacity at the moment. Okay. Do you have
Okay, doctor.
okay?
But when I see
Okay. Do you have any concern?
no,
Okay. I'm so sorry. Can you tell me can you tell me if you need any support?
No, I don't need support.
Okay. Nothing else. Okay. Do you have any more concern?
No, no concern, no more concern.
Okay. We have a time. أنا معلش ما مركزة اليوم. ثاني مرة.
15 seconds.
15.
15 seconds until
Okay. So what just to summarize our discussion, that what we're gonna do now, we need to keep your father in the hospital to make sure that he's safe before discharging him out of the hospital as a person of interest if of his condition. And the other thing, we need to do an MDT, a group of doctor. We can help you to, if you raise a complaint, it's still this is your right. You can have you can do that, and we can help you to by referring you to the patient reagents. I forget the
Patient
name.
Advice Liaison Services. PALS
I
office.
forget the name.
PALS office. No worry, you will memorize it next time.
Yeah.
Anyway, the time is up, Dr. Maya. Thank you.
Yeah.
You did well. Let's hear the comment from Dr. Marwa, then I will comment.
yes, Dr. Judith, when you explain first you didn't explain the importance of warfarin, but you explain what happened and side effect and its possible side effects from warfarin. Um, the concern regarding taking his father out, I think it's better to say it is due to his condition and it is not suitable for him, better than saying it is because he is lacking of capacity and we do the best of him. That's only this comment from me.
Yes, thank you, Dr. Marwa, for the scenario. I agree with Dr. Marwa regarding the concern of taking the father out. Better to ask him or to ask her why you want to take your father out or home. Because according to the answer, you will address it. So don't give it as confrontation. No, you will not take because his capacity is okay, or whatever you want to mention. Better to address why. This is for any scenario about discharge against medical advice. Why you want to take him home? Why you want to go home? Why you want to be discharged? And accordingly address it. In this scenario, whatever she will tell you, address it. Okay. This is regarding the discharge of the father against. If she mentioned something in the hospital, in the management plan, reassure and address accordingly. If she said, no, doctor, it's my wish, this time only you can argue with her. No, I appreciate your worry and your care about your father, but in this condition, we are restricted to the medical team decision because of the best interest of your father should be followed by our medical team. This is the way how to, but don't start with the confrontation. No, it's not yours. It's his wish or his the capacity or whatever. Okay. Regarding the main idea of the scenario, we know that this scenario came many times as complication, not error. But please don't follow every scenario as the idea of the scenario will be the same. What I mean, they are playing with the idea of the scenario from center to center and from diet to diet. So you might have the same scenario, the same concept, which is the hematuria and warfarin and stroke. But sometimes they are playing with the background. So maybe it's as an error,
Mm.
or it might be as complication. Please read the scenario well because you might have the same concept with changing the hidden agenda. How to know that? You will read the scenario well. If you find that it was stopped in the best interest, go ahead with the complication. But if you feel or they wrote for you, it was mistakenly stopped, this time you have to do the apology and follow the medical error steps. In both scenario, if the daughter or the son is not satisfied about the management plan, refer her to the PALS, Patient Advice Liaison Services, the office concerned to the complaint. And this is, by the way, this is your right. Be sure that the complaint will not affect his management plan. Always try to mention this phrase. Why? Because it's assuring the patient, son or daughter, that even with the complaint, we are taking care of your father. Okay? This is the main idea of any scenario nowadays. They are playing with the hidden agenda, either to be complication or to be an error. But if you know the details of the scenario, you will know what the scenario is about. Okay, so we cannot stick to one idea. They can bring it in many ideas. This is what I noticed. I noticed really. Yes, Dr.
I think
Maida.
this is specifically this scenario. If this patient like have
Yeah.
metallic valve, will not stop the warfarin.
Okay.
It will not stop.
Dr. Marwa mentioned the metallic valve
No,
verbally.
No,
no. That's
mission
why
cardiac heart
I'm take it
problem, but
like
not.
I'm take it like not mistake. It's just a medical decision. That's why I mean if it is metallic valve, it will be the scenario different. It will be mistake.
That's why, Dr. Maida.
Yeah.
It's not written here as a metallic valve. So how you have this information and how you have the guarantee, this is a must,
Uh,
right?
no, that's why I'm telling this is not mistake. I said to her the GB waiting the benefit against the
Yes,
side
I
effect.
agree to say that, but you
Mm,
have to know what the background of the patient,
yeah.
how
Mm,
to give her information which is not written in the scenario, and assuming that this is not an error or this is an error because he has metallic valve, he shouldn't stop this warfarin. So you make the scenario totally different from complication to an error, and she will have the right to complain. And you make it as a trouble. You put yourself and your consultant in a trouble, not the consultant, the GP. In the same time, it would be as a complication because of the hematuria. We stopped the medication in the best interest, as you mentioned. So it's not an error.
yeah.
That's why you have to read the scenario. In the details, they are playing with the words and the sentences. So it will appear for you like it's an error, or it will appear for you like as a complication. How to judge from the words itself, from the scenario itself. So you have to take care of every sentence. Read the scenario many times. You have 5 minutes, and please read the task clearly. If it was medical error, do the error steps. If written as uncertainty or written something else, complication of the medication, talk to angry son or the angry daughter. So you have to do whatever want from the scenario to do.
Mm.
Clear?
Yes, clear.
Okay. Please don't add any. I mean, don't invent. Don't say because of something he doesn't have, or you assume he has it while the patient doesn't have it. It's like fatal mistake. Maybe they will give you by minus a lot of marks. They can give you maybe 5 or 6 because the scenario totally changed.
But Dr. Mayada didn't make it as medical error. She explained it is not error.
Yeah, yeah. I'm trying
But
to tell
but
Dr.
now
Basi
she's
that
saying the opposite.
No,
no,
but in
I'm
scenario she
telling
didn't.
you, no, I'm telling you that it can be changed if we
Yes,
add
it
this
can be.
information. I'm telling you that, but you are
Yes, I.
okay.
That's why I said you mentioned as in the best interest,
Yeah.
but you said now the
If
metallic valve. Yeah,
If
you mean if, okay,
if
okay.
yeah, if
I
they
agree.
add
I
this,
agree.
it will
Yes,
be completely
sometimes,
different. Mm.
exactly. So sometimes you will bring it as a background of whatever the reason of either AF or metallic valve,
Mm.
suppose also to be hold, or even if they will stop, it will not be for this time or for this long time, 2 weeks or whatever. That's why the details is very important. This scenario, Dr. Marwa bring the scenario as vague scenario. It's not detailed scenario. In the exam, it would be more detailed from by whom it stopped, for how long and why, for background of what. You will have good details more than our scenario now. The scenario in the exam, it's like 1 page, more detailed scenario, not like Dr. Marwa. It's not an issue by Dr. Marwa. No, it's sometimes the message, most of the words will be dropped, and the scenario will arrive as you see in the scenario now.
Yes, I bring this scenario from pre-course with no much details, يعني, with little details.
It's okay, Dr. Marwa. You have to
Mm.
train about every scenario, but be sure that you read the details of your scenario. Not
Uh,
now in the exam. I
mm,
mean, it's
Dr.
okay. Now
Professor,
we are training. Yes,
uh,
Dr. Marwa.
if I read the scenario in exam and it become vague for me and I cannot judge it is a error
Perfect.
or
Perfect.
complication
So it would
and
be what?
I will proceed as uncertainty.
Perfect. Yes.
What I will tell the surrogate, what I will tell him.
Okay. Check the scenarios, the patient or the surrogate sentences, what he wanted you to address. He will give you some clues that it was as a mistake, or it was okay, uh, or at least from the background, the surrogate will tell you. You can take some hints. You can get some hints about what he wants to tell you. Is it mistake, clear mistake? And if you don't have any of both, so be as neutral. Talk as
Yes, I want to be neutral in the exam with the
yes,
surrogate.
but
I will
don't do
avoid.
it with clear mistake.
Mm.
If you
So
do
we
it in a
we
clear
can say
mistake, yeah, yes,
we
Dr.
can
Mar.
say مثلا we need to make more investigations and know if the GB book
Okay, yes,
follow
it's
up appointments
yes,
مثلا and
yeah.
you didn't come or what happened exactly we don't know.
This is in one occasion, Dr. Marwa, if you are not sure about the event. But if you are sure, do the best and the most appropriate
I answer Dr.
performance.
Mohi.
Yes, this is for Dr. Mohi. If you are not, you are in doubt. Is it error? I am not sure. Is it complication? And be sure the surrogate, when the surrogate repeat the sentence or repeat the concern many times, you can understand there is something wrong. Why he repeated again? Okay, some surrogates they are smart in the form of repeating the concern. So whenever he repeat the concern and you feel like you didn't satisfy him, there is something wrong in your answer. So you have to correct your answer. For example, it seems like a mistake and you didn't apologize. You said, okay, we will see, we'll investigate, everything will be fine. And he repeated again, doctor, I think there is a mistake. Okay, be sorry for him. If he repeated again, okay, so our apology to your father. خلاص, it's already, as you know, like you will not lose whatever already you lost.
mm,
Do it
yes.
as the third, after the third repeat. So the surrogate seemed like he's not satisfied and he want you to apologize. Some surrogate like this, by the way. So they are smart enough to repeat the concern many times to push you to do this. But if you feel like yourself convinced and confident about the task, clear error, follow the error steps from the start till the end. Uncertainty, and it might happen, but it's not common like the medical error. The medical error, the most common and repeated and recurrent scenarios in the cases. You'll be lucky
يعني
if you
في
have. Yeah.
كان في سيناريو يا بيه يعني قريب كده بيقول انه
Okay.
one patient 65 years old he has asbestos before and he came with shortness of breathing and x-ray done showing multiple pleural plaques and they did some investigations and all are normal and the oxygen saturation and room air is normal. So,
Yes.
so the GB, the
The
ER
CT.
doctor,
Yeah, CT
discharged
done,
them.
and they discharge him. He came back with cardiac
Yes,
arrest, and the
yes,
CT showed PE.
yes.
Yeah. Okay.
Yeah.
We discussed this scenario before.
Mm.
PE
It,
is
it is uncertainty,
yes,
well, error.
exactly. No, it's not error. Okay, let's assume the CT, the first CT or the initial CT didn't show the PE, right?
They did not do CT because patient oxygen saturation is normal and they did not suspect at all this patient is BE. They
Okay,
discharged
I
him.
there
think
is
they did CT but without
yeah, this is that's
Yes,
why
yes,
the details will be closed for you. Okay, let's start with the first example. One scenario I hate. They mentioned that the junior doctor see the patient and he didn't prescribe CTPA. Whenever you hear or you see in the scenario junior doctor, it is
error.
yes, exactly. Yes, it is error. Suppose he will request the CTPA, but he didn't request. So this is first example. Second example, no, it was prescribed in the best interest of the patient, the CTPA, and it didn't show. But he despite that he came back as a cardiac arrest, and he did. So this is what this is in the best interest, right? They did the CT and it was not showing anything, despite that after 2 weeks he came with cardiac arrest. So the PE might happen after this event of the CT.
Mhm.
This is the second example. Let's take the third example. They didn't request the CT at all, and in the best interest of the patient. The patient was okay, the conscious level, the saturation, no short of breath, and they discharge him. He came back as again sudden cardiac arrest, and they suspected it could be the PE. What do you think about this scenario? So they didn't do, but when he came back, came as cardiac arrest. They suspect the cause of arrest is PE. What do you think? This is uncertainty, right? They didn't do the CT initially, and they didn't do it late after he came, and we don't know the cause of arrest. We just assume there is cardiac arrest because of maybe PE. In this scenario, you can raise up the issue of postmortem, right? To know the cause of arrest, and it's not a coroner, just postmortem to study why this patient have this cardiac arrest. Is it PE? If the family refuse, it's not important, is not by force, or it's not mandatory to do the postmortem. So you might have the same scenario, as I said earlier, the same concept but different ID. You got it, Dr. Muhi?
Yes, yes, sir. Yes, yes.
So follow your sense always. This is my general advice for the communication. Follow your sense and the task and the scenario. If the task is clear, do the task and finish your scenario. If the task is not clear and you don't know, this is error communication, follow your sense and try to be diplomatic in such scenarios. Don't be clear as an error and don't be as no error. Do the diplomatic way or the neutral way. No apologize, be sorry. The best thing is to be sorry. It's not something harmful to be sorry for the patient, right?
Yes, yes.
Maybe
I'm from
if you didn't apologize, they will minus you and there is error, but it's not clear error. But if there is clear error, you have to apologize and you will gain the mark. But it's if it is not a clear error, you can be sorry for the patient And if they will minus you because this is not clear error, they might minus like the borderline or not harmful for your marks.
Sorry for what happened to your father, and we can
Yes,
imagine.
yeah. It must be quite distress for you and your family and so on. Try to use these phrases to be more sympathetic to say sorry, empathetic to feel what he's feeling now. But if the error is clear, definitely you have to apologize from the start till the end, and it will be written in the task medical error. I hope it's clear now. The message delivered in a smooth way. I know.
احنا يا دكتور
Yeah.
باسم، احنا اتعلمنا حاجه كده من الدكتوره سلمى اللي
Okay.
معانا.
Yeah.
بتقول حاجه انه يعني when the surrogate say I wanted to submit a complaint,
Mm-hmm.
we should not say okay and I will guide you to the patient advisory and raise it.
I agree with this.
لا.
Yeah, you should try with her or with him. Yes.
Yes, I'm sorry, we
Yes,
go to
exactly.
this way and like this يعني.
Yes,
And
exactly.
كده not agree directly for the complaint.
Yes. Try to make it in this way, but in the medical error, don't try to defend. Clear medical error, you have to admit, yes, there is a mistake. We are sorry for this, and this is your right. Don't argue with her if there is error. But if there is no clear error, like this patient feel something happened for his father, there is negligence. Maybe the daughter is assuming that. So you cannot say yes and you cannot say no. But try to address why you want to complain. And we are sorry to feel like that. If she insists, yes, again, it's her right. What I want to say as a take home message, if there is clear error, don't try to argue with the patient or the surrogate. Guide him to the office responsible, which is PAL's office. By the way, when you mention PAL's office in the medical error, you will get mark. If you didn't mention the PAL's office, they might minus you. You got this? It's very important to mention the PAL's office. Imagine you try to argue with her why it's not a it's not intentionally, and you try to defend about the event and you didn't have the time to refer the patient to the PALS office. And it was a clear mistake. This scenario was about clear mistake. What do you think? They will minus you definitely. So
Yes.
it's always according to the scenario. And the scenarios nowadays they are changing the main concept, but the same idea of the scenario. Sorry, there was some noise. I think someone was talking, but I think your mic, Dr. Muhammad Al Amin. Yeah, adjust your mic because it was little noisy. Is it clear now, Dr. Muhi, about the error, uncertainty, and complication?
Yes, sir. Yes.
And hopefully, you will have a clear scenario without this dilemma. For example, procedure, explaining a disease, explaining a medication. All the things will be straightforward. You can do it. End of life care, palliative care, without the uncertainty and the idea what to do. Is it in this way or the other way? So some scenarios like this. And by the way, they will not bring two scenarios unclear. One of them will be clear. So try to do your best in the clear scenario, and the other one, which is unclear, be diplomatic and try to gain as much as you can from the other skills. For example, the clinical communication, the question listening, and the other skill is clinical judgment. Maybe they will minus the clinical judgment if you mention something supposed not to be done. The second or the third skill, the concern and the welfare. Even you did wrong about the clinical judgment, like for example, you didn't apologize and a patient have a medical error, but you maintain the welfare, you maintain answering the concerns, you did clinical communication in a good way, you might have 12 out of 16. So you will lose only the marks of clinical judgment. But in one occasion, you did the other skills in good way. You got it? Is it clear now for all? And again, it depends on the examiner wish. Some examiner, if you didn't apologize, whatever you will do in the scenario, he will not do. He will not give you the marks. That's why sometimes the examiner will be the barrier of the marks. But hopefully, you will have a good and fair examiner. He will give you the marks according to your skills, performance, every skills. Okay. Any question before moving? We have discussed this issue a long time. Any question before moving, Dr. Muhi? Is it significant, right, from GP to stop warfarin 2 weeks after hematuria?
Scientifically, because
Yeah,
I don't.
it's significantly right from GP to stop the warfarin 2 weeks. If you go back to the scenario, you will know exactly is it right or is it proper to stop it for 2 weeks. By the way, Dr. Ahmad did this scenario as uncertainty, and when we asked him the stoppage of warfarin for 2 weeks, is it proper? He said, for the hematuria, for the sake of the patient blood and hematuria, yes, supposed to solve the problem of hematuria before resuming the warfarin. And we, again, I repeat the same idea. Dr. Ahmad, as an examiner, he's good examiner and he's kind examiner. If you follow these steps, he will give you good marks. You might face another examiner and you will say what Dr. Ahmad mentioned, but he will minus you. Why? Because he doesn't want you to say that. So it depends on the scenario and it depends on the examiner. What I mean, it's not white and it's not black. There is gray zones in every scenario. You don't have the guarantee that it will be correct unless you have the clear scenario and you will know the mind of the examiner, what he want from you. But let's do our best. Let's do our best to deliver the task in a proper way, whatever the scenario and the details of the scenario. But please read the scenario well. Try to read it try at least 3 times and try to know what they want from you in this scenario. Okay, let's move to the next scenario. Dr. Maida, did you prepare a scenario for Dr. Marwa?
Okay, I sent in the group.
Okay, just give me a second to copy. Okay, the patient presented with a tingling sensation in the scalp. She mentioned she has history of cancer. After assessment, the consultation suggested that her symptoms are likely related to anxiety. The patient was informed of this diagnosis. What is the diagnosis? You mean anxiety disorder?
Yeah, so the patient mainly thinking about cancer. She come with this tingling sensation, thinking about cancer, and the consultant, he said no need for CT scan, no cancer. This is an anxiety disorder, and just let her go. So your scenario to explain to the patient that she didn't need CT scan, and this is just part from her anxiety. The name of the patient is Miss Fatma. Her age is 60.
Okay,
Really?
I'm writing it down, Dr. Mar. Miss Fatma, 60 years. Okay, the scenario now in the chat box. Mrs. Fatima, 60 years old. The patient presented with tingling sensation in the scalp She mentioned she has history of cancer. Family history, you mean, Dr. Maida, right?
She thinks that this is cancer. She insists this is cancer. She needs a CT scan.
Yeah, after assessment, the consultant suggested that her symptoms are likely related to anxiety. The patient was informed of the diagnosis. I added this sentence. Consultant decided that it is an anxiety disorder, but the patient, I will add, but the patient insisted to do further scans, right?
Yes.
The patient is insisting to do further scans to rule out cancer. Clear now, Dr. Marwa?
Yes, but she didn't. Did she want to do the CT scan? She didn't.
Yeah, she want to do the CT to confirm that she might have a cancer. Anyone has question or doubt about previous scenario? When you're ready, Dr. Marwa, let me know.
We can start.
Okay, here you go.
Hello, good morning. Hello. Hello.
Dr. Maida? Dr. Maida?
Hello, are you hearing me? Hello, are you hearing me?
Yes, ma'am. Yes, ma'am. My name is Dr. Marwa. I'm the doctor in the clinic today.
Yeah, fine.
Can I confirm you are Mrs. Fatima and you are 60 years old?
Yes, I am. Thank you. Yes, I am.
We are today discussing some issues related to your medical condition. Is it okay with you?
Yes.
Before starting, can you tell me what you know about your medical condition?
Yes, doctor, I have this tingling sensation in my scalp, and this is not the first time. This has happened several times. I'm so concerned about problem. So I came to the hospital asking for a CT scan for my head, just to make sure, because I'm really
Okay, Mrs. Fatima. Uh, after discussing your medical condition with our consultant and after their assessment, they give diagnosis to your condition. Do you want me to explain it with you? Should I tell you?
Yes, doctor.
The diagnosis to a condition called anxiety disorder. Do you heard about it before or you know it before?
No.
It is a condition in which the patient due to stress and stressful conditions start to
Dr. Marwa, can you adjust your mic, please?
أيوه. It is a condition in which the patient suffering from a real feeling of pain or tingling like you have, but it is not organic organic cause. It is like functional cause. It's due your body responds to the stress. It is called an anxiety disorder. Are you with me? Is it?
So you're trying to say that I'm mad.
I'm sorry that you understand that this from my speech, but actually no, I didn't mean that it is you are mad, but it is a real feeling that you feel, but it is not of organic cause. That means that when you expose to stressful conditions in your life and your body start to react to this stress by different ways. One of these ways to express abnormal sensations like pain sensation or tingling sensation as you have.
Doctor, how you are quite sure you didn't
Is it
even
clear?
give a CT scan for me to rule out? How you are quite sure that there is nothing in my head?
I highly appreciate your concern, Mrs. Fatima, but not only CT scan. I mean that CT scan not the only tool we can diagnose your condition by it. There is we can diagnose your condition from your history and from your symptoms and from other investigations to your blood or other blood test يعني. I mean sorry.
Okay,
So we okay, continue.
it's okay. I'm listening.
CT we can when it is indicated it is yes it is useful, but when it is not indicated as in your case it has many side effects or bad effects in your body, and repeated exposure to radiation in city may be harmful more than useful. Thank you. Can I know
Okay.
what you think you have a cancer?
Because my mom that died of cancer at the same age of mine, and I think she go through the same thing. She had this problem, and then she was diagnosed with cancer.
I'm sorry for what's happened to your mother, but cancer it have a wide variety of types and symptoms, and differ from one to one. And it is not a must that your mother have a cancer. You should have the cancer. But if you will have any alarming symptoms, we 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 have to do you for you the necessary investigations. But in your situation, CD is not necessary and carry harmful effect to you. And we
Okay,
know.
so what do you mean by alarming symptoms? What's alarming you to do a CT scan for me?
If we talk about your symptoms like tingling sensation in scalp, I think you think that there's cancer in your head or in your brain. Am I right?
Yes.
So cancer in brain have other symptoms other than tingling sensation like severe headache, blurring of vision, vomiting, weight loss, more other symptoms other than tingling sensation. And the presence
Doctor,
of family history not enough to suspect cancer in your case.
Oh my gosh. I think you're underestimating my symptoms.
I'm sorry to feel
You just
that you feel that
early to come early. Yeah, because my mom, when she's been diagnosed by cancer at that time, they told her it was so advanced and she came so late. And when I am I am having this symptom, I'm asking for the CT scan to rule out there is no cancer and to make sure that I came early if this the case, and you are just kicking me out of the door.
Hello?
2 minutes left. I guess from Dr. Maida connection.
Yes.
Yeah.
Mrs. Fatima, can I ask you now?
Okay.
I'm sorry for what you're feeling now and that we are underestimate your condition. But now I need to explore some sites in your life other than this site, if you allow me. Can you tell me what you're doing for living?
I'm a taxi driver.
You are okay. Do you have? Are you married and or you have kids?
Yes.
Hmm?
Yes, I am married and have kids.
Do you have any stressful conditions in your life or in your work?
No,
Hmm?
I didn't think that I have stress in. No, I didn't have stress in my work or at
Hmm.
home.
Okay, that's good. Uh, do you smoke or drink alcohol?
No.
Okay. I need to assure you again, Mrs. Fatima, that your symptoms after assessment of your condition by the consultant, they diagnose you by this anxiety disorders. That means that doesn't mean that you didn't feel this sensation, but means that your body acted to this sensation or receives this sensation by. Sorry, I'm sorry. I think the time is up.
Yes, time is up, but you did well, Dr. Marwa.
I didn't think it was.
No, really, you did well.
Okay.
Okay, let's hear Dr. Aish, Dr. Maida comment, then I will comment.
Yeah, you start well. You did well. There is a lot of good areas, but normally this type of scenario is difficult because the patient insisting that he has a problem and insisting to have investigation, but he didn't need.
It is
Anyway,
not
this
due to stress in her life, but
type
the
of scenario is
anxiety by
difficult in real life, and
her life. We will do the city.
uh, I take this anxiety to you.
أيوة.
Yeah, this type of patient is difficult. Uh, the good thing that which I like that you are when you start to understand what the complaint of this patient. She's come with stinging sensation, and you try to explore why she's thinking about cancer, and it be clearly that because she is thinking with the family history with her mother that have the family history of cancer that make her anxious about the disease. So you try to explore the area behind it, why she's thinking about that. And you also explore that the CT scan is not on her best of interest because the side effects overweigh the benefits. But in this area, I think if you explore more, that's what is the side effect of this CT scan. You can also mention one of them that the radiation
Cancer.
can
But I think like you,
can lead to cancer.
but once CT once يعني that not will not be harmful يعني
It's
very
still
harmful. He
Unnecessary,
found
doctor.
once
Regardless,
unnecessary but يعني not harmful.
unnecessary radiation.
yeah, unnecessary.
It can cause
Regardless to the number, it's unnecessary. Either it would be necessary, so we will do it, or not. It's not once or twice or according to the number. Okay.
yeah,
Continue,
because
Dr. Maidens.
you'll expose the patient for unnecessary radiation. Okay, if you tell her this is the side effect, or you concentrate about the side effect of the CT scan itself, if we did it and we will not benefit from it, so just radiation, she may be convinced. And you tell her there is other modalities to diagnose cancer apart from CT scan. Well, I am not. I think I'm not agree with bloods cannot diagnose cancer, especially brain cancers, especially.
Not
So
not diagnose cancer but suspect cancer or not suspect.
even what you suspect from the bloods,
يعني if metastasis مثلا
head
bone marrow
or brain
infiltration
cancers, it's unlikely.
Yeah,
Yeah. So
I agree.
you said that there is other modalities.
I think clinical,
So
yeah.
it's not the modality.
Yeah, the clinical will be more,
So it's clinical,
yeah,
more susceptible. So this
exactly.
patient has a point that she said that her mother came when she has been discovered with the cancer. She was already late. That's why she's afraid, and she thinks that she came early with just tingling sensation. I think in this area, you need to be more empathic with this patient. You need to be empathetic with her and to try to understand her point of view, why she's so worried. And if you understand her feeling and appreciate that feeling, and just uh, show her that you understand why she's worried, and if you are in her place, you may have the same thing.
Dr. Mayad, I think Sabina is right in this scenario.
Reassure her again. Mm-hmm.
I think
Whom?
she is
The
right in
patient, yeah.
this. I think
Yeah.
she is right because so
Yeah.
I can't speak with her because
Uh,
why not do CT and reassure her?
yeah. Uh, بس هو بيحب يعمل سيناريوز انا بحس انه السيتي سكان I will do it for her, yeah. And
Yes.
but it's still unnecessary as the
They bring
consultant
it to trust your scenario and trust your consultant decision. You should
yeah.
trust, even if your opinion is
Still
different.
to-
Till to be mistake
we
and
still
error,
trust
then
him.
they will do another scenario about.
For that one as well. So it's a way of empathy with this patient because she's believing that she has a cancer, and you need to appreciate that. Which I like that you appreciate that we know that you have a real pain, and real pain, but this pain is not your body. this is functional one. So it's okay. It's nice to appreciate that this is real, and we know that you are in pain and you are suffering. This is very good from your side
Dr. May,
when you mention that.
Dr. Mayan, I understand later in this one that the anxiety not the cause of the sensation, but the anxiety diagnosed by her attitude and insisting or doing something, you know, they diagnosed anxiety.
صوت بقى مفرط بعيد.
Yes,
يعني
so far, Dr. Mara, please try to be more closer to the mic.
I thought they diagnosed anxiety not due to stress in her life, and this stress causing the symptoms, but they diagnosed anxiety because he's insisting to do the CT, which is unnecessary for her. It is
No, she's anxious about
have a name in psychiatry, but I can't remember the name.
Conversion disorder.
yeah لا, yeah
Not conversion.
she
She believes that he has cancer and not have cancer.
Somatization.
Yes, maybe.
mm,
Anyway,
somatization, and
the
at the
same
same time
idea.
she is so yeah, maybe somatization, most
Somatization,
probably. Yeah.
somatization. But the same concept. It's not there.
Mm,
The cancer is
mm,
not there, and yeah, we believe you have feeling these
mm,
feelings, but there is no cause, no organic cause, as you mentioned. But try to mention what the meaning of
mm.
organic.
Uh, uh, wh- why she's mm, mm. They think anxious. Why anxious? Because she feel she had a cancer, because her mom has cancer as well.
Yeah,
So that's why she's anxious about the cancer, the same age, the same symptoms, and these things. So if you listen to the patient, you find out what behind this concept.
exactly.
Okay.
Yes, yes.
Okay.
Thank you, Dr.
Thank you.
Maida. Thank you so much.
No worries.
Yeah, let me comment on Dr. Marwa performance. You know how to communicate, Dr. Marwa, but you need to be more confident. Try to avoid, yeah, some Arabic words. You mentioned, yeah, by mistake, but try next time to have attention. I will not say it again. Okay?
Okay.
Yeah, but you can do it. You did it all the scenario. You did it once only. Apart from that, the introduction after confirming the patient name and age, and you can ask about the background. You ask her the expectation. What do you think? Do you have? What's ongoing with you? She will tell you, doctor, yes, I have a cancer. I'm sure there is a cancer. My family or my mom was having cancer.
She said already, and when she explained her
Okay, if
conditions,
she
she
said
said her
in the
expectation.
in the background, you can ask again. So what you expect?
Mm.
Okay.
She
If she
said, I
said,
expect cancer.
ah, yeah, she
She
mentioned
said,
I expect.
ah,
Okay,
yes.
I thought she mentioned my family or my father or my mother was having a cancer. Okay,
No,
if she expected that earlier, that okay, no need to ask about the expectation. Anyway, the explanation, try to avoid some jargons like organic cause. Yes, you
mm,
can say there is no organic cause, but you have to say what is the organic cause, what you mean by organic cause. So you can say, for example, no cancer or no nothing harmful or nothing showed in your lab or your blood test and your investigation. Okay,
طب how say uh, not organic?
okay, not organic. It's nothing alarming in your investigation.
Mm,
Nothing alarming. What you have is a condition called an anxiety disorder, in which your body overreact to the stressful condition in your life. Even the thinking or overthinking that you have a cancer maybe show that you have these symptoms.
mm. But alarming here will be in her symptoms, not investigations, because she want to do two investigations.
Yes, you
Al-
can
mm,
give here the examples of red flags
mm,
or alarming
mm,
symptoms in the form of the constitutional symptoms. It's
mm,
okay, loss of weight, loss of appetite, night sweats or night fever, plus alarming headache. You have severe headache that it's worsening whenever you wake up early morning, or you bend forward, or when you cough or sneeze. These cancers or these signs of increased intracranial pressure, it's similar to having a space occupying lesion, right? So loss of weight, the
Mm.
constitution symptoms, and the alarming symptoms of headache equal to possibility of cancer. Not necessary to be a cancer, but it's maybe or equal or alarming or warning symptoms that you might have a cancer. In the view of family history of cancer or brain cancer, we can that time do the CT. But don't worry, we are with you. Always reassure. Okay, you already frustrated head. You will not do the CT you requested, right? She will be frustrated. Why, doctor? I want to be sure that nothing. Okay, give her the alarming symptoms and red flags and warning sign. Then reassure her. Don't worry, we'll be with you. Anytime you feel these things, please don't hesitate. Or if you are,
Look,
yes,
when I said this to her, she said, my mother came in late stage, where she want to start in early stage investigation.
yes, we
Mm.
believe that. We believe that, yeah, sometimes the cancer might grow hidden. However,
Mm.
supposed to have some symptoms which showed that you have possibility of cancer. So whenever you pick up one of these symptoms, please visit us. Plus, we will give you leaflet brochures website about the brain cancer, how it presents. So you give her the whole background of the cancer presentation. Maybe her mother didn't know about the presentation. We don't know the situation. So don't go through what happened with her mother. Now we are about your condition, how to be early pick up the finding or the symptoms, and when to present to us. Forget what happened with her mother. We consider that. We respect the families is important in your situation. But everything now didn't show that you have a cancer. Okay? Clear now, Dr. Marwa?
Yes.
Then the point of social support and social exploring the social stressful condition, it's good to do it because you must have one of these. She might tell you the work issue, financial issue, and accordingly you address everyone separately. Sleep hygiene, she's not sleeping well. Even the thinking that she has a cancer and her mother was having cancer, if you feel like she's having low mood regarding this, you can refer her to the mood doctor. Am I mad doctor to refer me or to do so? The idea of the mood doctor not for the mad persons only. These or those people, doctors or physician or the specialists, they have the way and they have the better position to sit with anyone who has any stressful condition in his life, to talk with him and to address his concerns easily and without even sometimes doesn't need the medication. Just the talkative therapy, they might help you. So they are not only for those who's mad people. Clear this idea?
Yes.
Okay. This was so of course smoking, alcohol. Both of them they can add on, and they can trigger the anxiety. So you have to address as you did. And again, the support is very important. The job is very important. You can also offer the hobbies if you need something to think about. The yoga. Some doctors use the yoga as a distractor or something to relax the mind. Vacation, whatever the scenario will go, you have to address it. She will have something need to be addressed. I mean, for the social life. I hope it's clear, Dr. Mar. But in general, you know how to communicate, which is better now, I think, than before. I remember you did before with us the communication, but today is much better.
Yeah, Dr. Thank you.
Okay. Any question or concern or comments? Anyone has suggestion? Any doubt?
This really is the most difficult scenario that I suspect that I can do also because
Yeah.
the functional even they focused and it is
Yeah.
new. It is I think it's 1 year only they invent this scenario. But they didn't like to say to the patient that you have an anxiety or stresses like that. I heard from one mentor that they like you to touch it from far away because the patient will be angry if you she will say to you, are you think I am faking symptom? I am not mad. And also for psychiatrists, you can just we have specific team caring of this type of symptoms that is we called functional disorder. And this is a true disease and the true symptoms that your brain mistakenly having miss signals or misinterpretation of some signals in your body. So don't say to the patient
But
directly. You can
but
say
mentioned in
like
scenario دكتورة عائشة ما mentioned in the scenario diagnosed as anxiety. So
Yes, Dr. Aisha, I agree with Dr. Marwa. Whenever you have condition, you have to mention the condition. If you try not to mention or to give another diagnosis, or you didn't give clear diagnosis, which is written in the scenario, I think they will minus you. You can give
not
him
like
the
that.
name.
You can ask here, or you can mention it by. Can you share the scenario again?
Okay, I will show you not
I
the
go
scenario
out
because
again.
it's no, it's
In
okay. No worry, it was written that
because it is one in the scenario like that HIV patient that has candidiasis and they suspect HIV, and in the scenario they written that he is IV drug abuser before. So you will not say to the patient you have we suspect HIV. You will say like do you have any like that like that like that. It is one of possibilities that causing HIV more risk for you. So even if information, if it is like welfare to the patient, like cancer and smoking, if you said to the patient, this cancer because you are smoke a lot for long time, even if the scenario they said it is he is heavy smoker.
yes, we have to take care of these things. But again, if there is clear diagnosis, we will mention the diagnosis. But if not, yes, you
They
can.
didn't write it is generalized anxiety. The consultant just suggest it is from related to an anxiety.
I don't know, but
Mhm.
for me, I will do in this way. I don't know how
Yes,
to say.
I think I agree with Dr. Aisha because there is no official diagnosis with an anxiety disorder, but he suspects this secondary to her anxiety.
But it's a clinical diagnosis, Dr. Maida.
The
Just because this scenario it will be a conflict. You will see, يعني it is difficult, very difficult scenario for anyone having this scenario in exams. They talking that is very bad surrogate, very bad scenario that you can't manage good the scenario because he insisting and he's already, as Dr. Marwa said, he has already his like
has
reasons.
the
He has
right
reasons. Yes,
because
has reasons,
because
and
he is the right
they trying to push you to be with the patient in his side. So you should keep with the scenario, not with the patient. And just at the end, Dr. Bassem said you can making the red flag. Even I am not accepting this also, that to give the red flags because already she is worried. So if you mention some of them, she will say yes, I have.
mm,
I don't know really, but I said what I heard because also this I make this specific scenario with Dr. Hussam before. But it's not the same, but it's also it with the functional disorder that is not related to anything in his body. And it is difficult really to try to persuade the patient and try to avoid to making touch the welfare of the patient or to judge the patient or Just I am talking with you as my thoughts about if I'll do again this scenario. I can
But the
just
thing is that even if in the
mhm.
exam, if you are not convinced the patient, it's not. If you, I mean, if you take the right tract to how to
Mhm.
deal with this such patient, you listen well, you show empathy, you show them the side effect of the CT scan, and you do whatever you know, the tool you use to convince this patient. And the end is still like they are not convinced. You can tell, I will arrange another meeting with this consultant, and that's it. You are even in the exam.
Yes, yes.
Yeah.
And
So
we have is in your situation, there is sentence, a good sentence I heard from Dr. Hussam. These symptoms with patient like you or ones like you, generally we found that they have stresses in their lives. If do you notice that you are focusing, you having thing you facing these days, or you having anything beside your mother condition stressing you? And they're trying to suggest, as Dr. Basim said, taking a break from your job. You have one beside you supporting you. You have any friend can support you, or like you will suggest some things for the mood
mind
or
break.
the this
Mhm.
what would they call the health, the mood health.
Mm.
Just and suggest a specific team, not a mood doctor or psychiatric. We have a specific team dealing with these situations, and the ones like you, they can talk to you again and explore more with you the problem in your condition, and they can what is that to provide you with follow-up sessions, so they can follow up you regularly, and how you are uh, how you are always, and if this thing is improved, so she will feel that we will not leave here, like we will follow up, and we just will not here after refusing this investigation, and we finish with her, or we will close the door. We will arrange a follow-up session regularly with you. We will follow up you and follow up your improvement. We are keen about your health, and we will follow your improvement by ourselves, and we'll arrange follow-up meeting regularly, so we can reassure her that we will beside her.
Okay.
What's your opinion?
Okay, Dr. Aisha, you want to be as not affecting or not harming the welfare, right? I agree to mention a specific team or special team, but it's okay if to mention the mood doctor. It's not something bad. This is my opinion. I don't know also if you mention the mood team, what the problem, because he has or she has low mood. So what the problem if
I was doing that, but last session with Dr. Sabrine, and she is
okay,
living there in UK. She
okay.
said like that, don't tell the patient that she has an anxiety. Don't tell the patient that she should see the mood doctor. You will be in trouble with her and conflict, and you will touch her welfare you, because she is very sensitive at that time. When you deliver to her that she has no anything in the image, and you another scenario like that all investigation is normal, you don't need any other investigation, we just reassure you that nothing, your brain mistakenly receiving signals like that. So already she is like in bad condition, so try,
Yeah,
she said
okay.
like that, yeah.
It's okay,
Yes,
it's okay. No problem to follow this approach. We are also listening from all mentors. So, okay,
but really
acceptable.
it is hard scenario. I hope it
Yes,
will not
yes,
come to
yes.
even any
Yeah,
one of you.
yeah. Functional disorder is one of the difficult scenarios how to address because you don't know what the patient or the surrogate
We
want
don't
to
know what
tell.
they want, and we have no
Exactly.
feedback
Exactly.
already, not good feedback with the one already they
Yes.
failed some ones. يعني three of Dr. Hussam said that the three enter this station. He knows them. He failed the scenario, and the comment is not clear. This is the
Exactly.
problem.
Yes.
If they write good comment, we can know what they want.
Yes, exactly. So you might have also two different comments from two different examiners.
Mhm.
So you don't know what in their mind everyone. Anyway, we'll try to be diplomatic without affecting the welfare, and we'll
Yes,
address
and the
the
most
social.
important thing to trust scenario and trust the consultant.
Yes.
Not to said we will see again, or we will try to, or you or to ask again about family history or anything. Don't ask about any history again,
Yes,
because
of
if
course.
you did that, they will write for you. You didn't trust your consultant. If you ask again about symptoms,
Yes, you're right.
this is the important thing, and I think it will be fatal. But other things, I think we are trying. Yeah.
Yeah, we are trying, as you said. So you cannot have guarantee that you will do this and you will get the whole or the full mark. At the same time, you might do something else, they might minus you. It depends again on the examiner. But the clear scenarios, straightforward scenarios, you can gain the marks easily. Palliative, end of life, medical error, as I said, counsel disease, counsel about condition, counsel about medication. But these vague symptoms and vague scenarios difficult to approach. Hopefully, you will not, or you will not, or Dr. Marwa will not face it, inshallah, in the exam. Any added suggestion, Dr. Aisha?
No, thank you. Or
Oh, okay, thank you, Dr. Aisha. Any comment, Dr. Maida? Dr. Marwa, question? Okay, I read the comment here, Dr. Hatim. Thank you for the correction. Yes,
Thank you.
thank you, Dr. Maida. Okay, yes, the hypochondria is the one believe that I have a cancer. Yes, you're right. Somatization is for symptoms only. Yeah, good to correct. Thank you, Dr. Hatim. He asked, shall we discuss with the candidate the plan of management of her this about this functional disorder? The plan of management will be as supportive or social support or psycho support to address what the reason behind these symptoms. If written in the exam on the scenario, address with an, for example, anti-depressant medication, you will address. If not, don't raise it at all. Okay, this is the way how to address functional disorder in the exam. You have to address the social and the stressful condition. If they wrote in the scenario there is pharmacological or medical option, you can read. And if the surrogate asks you clearly, is there any option or medical or medication should be offered, you can tell him diplomatic again answer. Sometimes there is medication in such condition. We will address and we will refer you to the special team to sit with you. If there is possibility, they will write. So don't be as yes, there we will give you this medication, and don't say no, it's not. There is no medication. So you give as a diplomatic answer. Okay, always be diplomatic in your answer. Don't be clear if there is no clear task. But if there is clear task, talk about amitriptyline. So you have to talk about amitriptyline. Don't say no, it's not the time to give. No, if written, you have to do. Okay, clear. Okay, thank you, Dr. Maida and Dr. Marwa. A special thank to Dr. Maida because she wasn't prepared, but she saved the session. We were about to cancel the session, so we have to thank her again and again. Thank you everyone for the comment, for the sharing, for the attendance. See you tomorrow inshallah with long clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.